If you're thinking of enhancing or enlarging your lips, there are basically two different options available. One is fillers, the second is lip lift surgery. I'm going to go through the details of the surgery and the fillers and go through the pros and the cons of each one of these procedures, and you'll decide which one is ideal for you. So let's talk about why people may want to enlarge their lips. First of all, it's cultural, it's trending, and people want fuller lips. However, there's a certain ratio that is typically found normally in certain races. For instance, in Caucasian patients, they typically have a 1 to 1.6 ratio, meaning the lower lip is fuller than their upper lip. And in black patients or other ethnicities, typically their ratio is 1 to 1, so the fullness of the upper lip matches the fullness of the lower lip. That has to be taken into account in terms of the amount of volume we're going to aim for if we're going to look for what I call natural outcomes. Now, the truth is that many people are now choosing to go with enlarged upper lips, which then change the ratio between their upper and lower lip to be a 1 to 1 ratio, which does not necessarily, quote, match their ethnicity. That's their choice, of course. It's not my choice, it's their choice. So lip fillers are off the shelf. The advantage of using them is that you can preview what your lip is going to look like without having a permanent change in your lip contour, which you may not ultimately like. So that's certainly a very important aspect of considering having a lip injection first. The second thing is it's dissolvable. So if you don't like the way the lip filler appears, or there's something unnatural about the way it was injected, it can be reversed with hyaluronidase, which is a enzyme which can break down the hyaluronic acid gels, which can be either Restylane, Juvederm, and there are many other products on the market now that can be used for the lips. In addition, you can enhance your lower lip, which is not possible with a lip lift surgery, which is focused only on the upper lip enhancement. So even if you have lip lift surgery, you're still going to have to enhance your lower lip in some fashion. Some people use hyaluronic acid gels, which again are the things I just mentioned, or sometimes they actually inject fat into the lip itself. I think there's pros and cons of each one of those types of injectables as well. But that's not possible just with a lip lift surgery. That's only with injections. So let's talk about lip fillers and the risks associated with lip fillers. I consider lip fillers to have a low risk to benefit ratio. What I mean by that is, yeah, there are potential side effects of any injection on your face and certainly around your lip. By injecting lip fillers into your lip, particularly if it's a little deeper than the superficial submucosal region, you can end up causing occlusion of blood vessels, which can cause what's called ischemia, loss of oxygenation to the tissues, and necrosis of the lip. This side effect, of course, is very rare, but it does happen. So that's one of the side effects that we have to think about. The other one is the material can drift with time. There are people who have repeated injections in their lip, and the material can drift. Some of it can remain and cause some scarring and inflammation. This particularly occurs, I believe, if it's injected deep within the red portion of the lip. I don't encourage people to have deep injections in the lip. I used to, when I initially started injecting lips, I did inject deeper into the lip, and then I recognized that I get a better, more natural result if I inject just below the mucosa of the lip. The other downside of lip fillers, of course, is that they only last a short period of time. In most cases, because our mouths are constantly in motion, the lip fillers only last about 6 months. And sometimes it's shorter, sometimes it's longer, but they don't last that long because I believe the movement of our mouth, eating, talking, etc., causes the material to dissipate more quickly. Now, if we look at lip surgery is obviously long-lasting. It has the advantage of shortening the distance between the bottom of your nose to the vermilion border, which is right here. And there are many people who have a lengthening of this distance from the base of their nose to the lip line, and particularly as they age, it lengthens. But there are people who are even born that way, and it is certainly advantageous to shorten that for aesthetic improvement. Whereas lip fillers can't really shorten that distance. It can't do anything to shorten this distance. It can rotate the lip and enhance the margin of the lip, but it can't shorten that distance. So that is a disadvantage of lip injections. In addition, when you shorten this distance, you get more tooth show. So when you get more tooth show, it is a sign of youth, because as we age and this lip lengthens, it tends to hide the teeth when we smile or talk. So in order to get a more youthful appearance, shortening this distance can help. Whereas lip injections in those cases really do not help that aesthetic issue. There are 4 categories of people who I don't think are ideal candidates for a lip lift surgery. Those people are typically, one, they either have a gummy smile, which means as they smile, there's exposure of their gum line, and it only will get more exposed by shortening the distance from the base of their nose to the lip line. The second type of patient has large teeth, or an overbite of their upper palate to their lower palate, and by doing that, their large teeth also will, you'll have more tooth show as a result of shortening that distance. Some patients have a neurologic weakness of their mouth and asymmetry and weakness of their lip. I don't think those patients are ideal candidates for lip lift surgery either. It only will enhance and kind of highlight that weakness of the lip. And the fourth category would be someone who has a severe downturning of their lateral lips. Yes, you can do a corner lip lift, but there are some people who have extreme degrees of a downward turn of their lateral lips, which are difficult to adjust. Those are the 4 categories, but in general, most people don't fall into those categories and can be candidates potentially for a lip lift. But again, this is based on age, ethnicity, what the goals and desires of the individual are in terms of the outcomes. And those things have to be considered prior to taking the leap to a more permanent procedure. So I've given you an overview of the differences between lip lift and lip fillers, and I hope you have a better understanding so you can make an informed decision on which way to proceed. I do believe, again, without being redundant, that you should start out with a lip filler just to get an idea of what you want and desire, and then ultimately, if you want to have a more permanent solution, then a lip lift surgery is possibly a procedure for you. I hope this discussion was helpful. Please leave any questions you have below. Please subscribe to my channel. I'm trying to grow the community, and I look forward to seeing you in my next video.